So hello from Cases of Morphology and Flow in Hematology. What do we have here? We have a recent quiz presenting a woman's multiple sclerosis history with this smear of her blood, decoagulated, with EDTA. This woman had infection, and infection was attributed to Coxsackie. So thrombocytopenia and leukopenia were correlated with the infection. But is this true? Here we can see a smear prepared from decoagulated blood, and there is evident the adherence of platelets to neutrophils and some eosinophils here. So what was our quiz? Our quiz was these options. Is there platelet activation? And we have platelets around neutrophils. Do we have immune leukopenia here from any reason with this whole picture of platelets around neutrophils? Is this attributed to heparin as an anticoagulant? Or all this phenomenon is not disease related? So we have all these options. We have not given a title to this phenomenon of platelets aggregated around neutrophils. So what is this phenomenon? This phenomenon is called platelet satellitism. Platelet satellitism is a rare and interesting in vitro phenomenon. It's a unique and uncommon in vitro phenomenon seen in peripheral blood prepared from EDTA mixed blood. It is seen in forms of platelets adhering to polymorphonuclear neutrophils. So, what are we going to say about all these options we have here? Are platelets activated in the satellite around the neutrophils? Is there an immune mechanism of leukopenia? Is it heparin responsible? Or is there no disease related? If we see this nice review concerning platelet satellitism, here we can see that, okay, this mechanism is an in vitro phenomenon. And one explanation are autoantibodies directed against glycoprotein 2B complex of the platelet membrane and neutrophil Fc gamma receptor. And EDTA is responsible for causing these alterations. So it's not an autoimmune, in a way, disease. And contrary to this, there is no in relationship to a pathology, though the literature describes many cases related to this phenomenon. As we can see here, it's incidental and could be considered as incidental. What should we be careful about? We should be careful about spurious thrombocytopenia or pseudothrombocytopenia in a case of incidental discovering platelet satellitism. Or when there is a pathology, we should be interested to attribute this to an activation of platelets, not to explain thrombosis and not to explain pathology. So, what is the correct answer? The correct answer are not disease related, and most of the votes are concerning this, and the majority is correct. Thank you for listening to me.